You are listening to the Body Charge podcast, and I'm your host, Sandy Sanderson. Welcome to the Body Charge podcast. Today's topic is, which is better, saving your own tooth or extracting it and placing an implant? The use of dental implants has been growing steadily in recent years, but there are potential issues that people may not be aware of and should carefully consider beforehand. My special guest today is Dr. Feinberg, a US nationally recognized lecturer and noted author of scientific and educational articles for dental publications, a textbook called The Double Tilt Precision Attachment Case for Natural Teeth and Implants, and a book of essays on dentistry. He's a reviewer for the Journal of Oral Implantology and the Editorial Board Member of AAIP's Implant, Prosthodontic Monographs, as well as the recipient of many awards for his pioneering work in dentistry. It is my great honor to talk to Dr. Feinberg for his great work in this field. Welcome aboard.
Thank you.
My first question is, why is it preferable, if possible, to repair and keep natural teeth rather than just pulling them out and replacing with an artificial implant?
Well, your own teeth are really the best. They have shown that natural teeth really have a better prognosis when they're handled properly than extracting a tooth and putting an implant in. There's a world of difference in how they adapt to the body, a world of difference. And a lot of people are treating implants as panaceas. Where they're indicated, they're fabulous, but they're being overused and used inappropriately as if they were the solution to every restorative problem. And that's really what I'm against. So what I have seen is an absolute epidemic of tooth extraction and implant placement. And these are teeth that I could save. And that's a tragedy. I think a lot of people don't understand, a lot of dentists don't understand what crown and bridge dentistry can do for patients. And they look at crown and bridge as tooth coverings rather than as something that's corrective, which is designed to compensate for all the problems, rather than just covering the teeth. So there's really two approaches to dentistry, in my opinion. One is an overall approach, which really considers prevention and the overall health of the mouth. And the other approach is what I call a piecemeal approach, which is filling a hole or a space. And I think the signature of a piecemeal approach is the single tooth implant. And the reason I say that is that that would be a perfect place for an implant if all the teeth around the space were in perfect condition and there was no periodontal bone loss. But that is not what you see when you go to the lectures and when you look at the articles that are written about placing implants. What you see is the teeth around the space where they're going to place the implant are falling apart. They have big fillings in them. They have crowns on them. And these teeth are going to need restorative work in the future. And a single tooth implant just fills the space and does nothing for those teeth around it. Whereas if you know how to do good bridge work, you can completely change the architecture to minimize the forces on the supporting structure. You can seal the teeth against future decay, and that's usually the end of the patient's problem. And so you are really solving restorative problems in an entire area rather than filling a hole or a space. And with that approach, the patient's problems are never solved, and they end up with a hodgepodge of all different kinds of restorations. So that's what I see going on. My background is very different from what's being taught now. I see a lot of people having difficulties with crown and bridge that were actually solved in the 1930s. I was trained differently. I grew up in dentistry, and my father was a master and pioneer of full mouth reconstruction and crown and bridge dentistry.
A little bit like a structural engineer. I've been reading
exactly
your
like
writings,
that. That's
and
exactly
you make a
right.
similar comparison. Yep.
In fact, I like when I give presentations to dentists, I like to show famous engineering disasters and their counterparts in the mouth because the principles of engineering are the same for both. So one of the shortcomings of implants is they very often can't place implants deep enough to actually support the restoration that it's going to hold and support. And so when that happens, you're overloading the foundation and something's going to give. And usually the implant goes because
Yeah.
implants are not like natural teeth. The natural teeth are connected to the bone by a ligament called the periodontal ligament. So there's some give there when forces are applied to a natural tooth. But with an implant, that's like sticking a nail in concrete, and there's no give whatsoever. So, what's going to give? The bone around the implant. And once that starts to happen, then that's the beginning of the end of the implant. And a lot of those implants fail not because they didn't take properly when they were placed, but because they were overloaded with forces. And this is being ignored by a lot of people in the profession, and that very upsetting. So if you know when to do crown and bridge and when to do implants, you can pick and choose what's really best for each patient because there really is no one size fits all. And yet, that is what I see. We have a lot of one trick ponies now, where there are a lot of people who can do very good implants, but there's less and less dentists who can do good crown and bridge. That's what I see. What is being taught violates the basic principles that came from dentistry's roots. And that's
Roots.
where I'm coming from. I
Yeah.
have 70 years of documented evidence that supports what I'm saying. And I can show cases in the mouth that I did in the mouth 40 years with very few changes. I
Wow.
can show these cases, and I don't see too many people showing them.
No, and the structural element is so important, isn't it? Isn't it? Because you mentioned stresses, they're transferred, aren't they? So when you use certain muscles in the mouth and you chew and you apply forces, this transfers along the length of the tooth to the bone that the root sits in. And if it's not getting stimulated, you don't have enough blood flow down in the bone area, you can get bacterial infection, all sorts of problems happening where you can't access or see it or even know it's happening for a while. And but if the structure is, correct me if I'm wrong, structure is adequate and optimal for the the health of the bone in the jaw, and the gums, everything is like one package, isn't it? They're different components of one whole system in the mouth. Then when those structural elements are in balance and working together, then all of the flow-on effect is beneficial to the muscles, to the bone, to everything that holds the jaw together. Is that correct?
That's absolutely correct. So there was a book written by Thomas Ford in the early 1960s, and he called the process of where people have periodontal bone loss force-induced degeneration. And he said exactly what you were saying, that when teeth take forces in abnormal directions, that interferes with the blood supply to the periodontal ligament. And that is one of the causes of periodontal bone loss. And in dentistry, once the bone is lost, we don't know how to grow it back. So everything that we do is prevention to prevent that from happening. Now, with implants, they're more susceptible to bone loss because they are really not, there's no give there
They're
in the
rigid.
bone.
Yeah,
They're
they don't.
rigid,
Mm.
exactly. So you have to make sure that you don't overload these things with forces. So one of the things that I don't like that I'm seeing is this type of restoration called all on four. And what they do is they pull out all of the teeth in an arch and they place four implants, usually two in the front and two in the back. And what happens is that they very often can't make the implants deep enough because on the upper the sinuses are in the way, and on the lower very often the inferior alveolar nerve is in the way and you can't go any deeper. And then they overload these implants with this big superstructure that not only replaces the missing teeth, but replaces the missing gum and bone as well. And these implants are not designed to be able to support that kind of load. And worse, they design it so that it's almost impossible to keep those clean, which is amazing to me that this could even be done, or would anybody would even do things this way, because there are some better choices, but it's more involved. It may take a little bit longer and a little bit more planning, but everybody wants something in a hurry. And one of the bad things about this is that if these cases fail, which a lot of them will, they flatten the ridges. So they may not be able to place additional implants, and then they won't even be able to wear a denture comfortably because the ridges have been flattened. So this is awful. I think that's not fair. I think we have to understand as dentists that dentistry very often is not lifetime, and there may come a time when these things may not work. So when implants first came to this country in the early 80s, they were doing them quite differently. Dr. Brannemark from Sweden, he was a true scientist and he did all the research. And he would place 4 or 5 implants in the front of patients with no teeth on an arch. And then he would just cantilever the 2 bicuspids off of the front 6 teeth. And he had a tremendous amount of success. But when you look in his book, he also knew not to overstress these things. So he designed them so that they were narrower than natural teeth would be, to put the least amount of stress on these implants.
As a good
And
engineer
then he
would.
made it very easy for them to keep these things clean.
Yeah.
So that's where they came from. So now this is a complete about face from those basic principles. I'm not saying that we can't do things differently, but we can place implants in the exact position that the teeth should be in so that you can have the restoration emerging from the gum in the same way that teeth emerge from the gum so that they can be kept clean easily. And that's what I did for most of my career. And if you can't make fixed bridge work, then you have to make some kind of removable that doesn't overstress these implants. And a lot of dentists are obsessed with fixed bridge work as the answer to every restorative problem. And that's how they're all getting into trouble, because very often that's the wrong treatment choice. And you have to be very careful that you don't overstress the implants, because they're feats of engineering and they're subject to basic principles of engineering.
Dresses, yes. And also the materials used, I always wondered if the titanium kind of leaches over time. Is there evidence in the scientific literature that some people at least may be sensitive to having some, allergic reactions?
I have never heard of anybody having a reaction to titanium. In fact, all the artificial joints are all made of titanium. So it's very, very biocompatible.
Yeah.
And then for the restoration, there are a variety of materials that you could use to make the restoration on these implants.
Yes,
And
can I just add one more thing? There's another material that's gaining popularity, which is a zirconium. How do you feel about that one?
well, I think it came from nuclear power plants and it belongs there.
Oh, okay.
For natural teeth especially. What this is there's 2 reasons why I don't like zirconia for natural teeth. And one reason is that it's a very, very hard material. And dentistry is not lifetime. And there's a point at which you may have to replace this restoration. And you could absolutely damage the teeth underneath trying to get one of these things off. And the other reason is they are what you call butt joint restorations. And that's a term that comes from carpentry. And what a butt joint is actually is a ledge that you place on the tooth all the way around, and then you make the restoration to the ledge. And this did not come from dentistry's roots. The problem with that is they can never be sealed. Bacteria are 2 to 10 microns in size, and the best marginal adaptation that you could get would be 80 to 120 microns. And everyone is expecting that the bonding crap's going to seal everything up, which is very unscientific because it's very sensitive to moisture, and the
Porous.
margins are where all the moisture is.
Yep.
And so, what came from dentistry's roots is uh, dentistry that was modeled on the mason jar cover, which is the best known thing ever devised for food preservation. So, when you make your restoration, you go beyond the ledge onto uncut tooth structure. So, you completely seal everything in. That's what came from dentistry's roots.
Yep.
And then in the 1960s, we knew all about butt joint restorations because they tried making the same types of restorations with ceramics, and they would bake these ceramics in an oven. And now they have a computer to do the exact same thing. You think we didn't know what was wrong with them? This is dishonest, and a lack of knowledge that was not passed on. I can't believe what I'm seeing. But actually, zirconia might be okay for implants because there is a very well-known uh, prosthodontist, oral surgeon from Lithuania who wrote a book, Zero Bone Loss Concepts. And he's very sharp. And he feels that there's less plaque buildup around zirconia than other materials used for implant restorations. So I have mixed feelings about that. But
It's
for
more of
natural
a
teeth, it's not a good material.
yeah, it's
And the
more of a
only reason it's
crystal.
being,
Yeah.
yeah, the only reason it's being used is because it's cheap and white. That's the only reason,
Well,
because it is not better.
I think it's also getting into the natural health community because it's a crystal and not metallic.
It is metallic. See, if you
It,
look at the periodic table, zirconia is a metal and it's combined with oxygen and the way they make it.
but how it's marketed is different.
It's,
Yeah.
yes, and that is a lie. It is a metal. That's what it is.
Yeah, so there's a lot to know about this if you're going to go ahead with a procedure like that. How would you, if someone had some so enamel worn away and the teeth are like half the size, they're a baby boomer, they're in the mid years, and they're looking to the bite is changing because the teeth are kind of shrinking, they're losing the volume. How would you go about that kind of restoration using the traditional methods that are more biologically compatible with the mouth?
Well, this goes back, this is a very good question. And this goes back to my discussion about a piecemeal approach versus an overall approach. And when you see somebody where you have teeth that has teeth that are worn, or there's missing teeth and things are collapsing, you have to look at why that is happening and what can you do to correct that. If you know what the problem is, then it's fairly easy to correct. You can come up with a solution for that patient. And one of the problems and one of the reasons why that happens is that the muscles are not in harmony with the way the teeth come together. So I put a lot of patients on diagnostic appliances to check out where the jaw should be. And then after 4 to 6 weeks of wearing the appliance, I can I can analyze that whole case. I can take a little wax bite and mount the models and see where the jaws should be. Very often, when you first get one of these patients and you take upper and lower study models of their art of their mouth, and you go to put the models together, the midlines don't line up. That's a tip off also that the jaw is not in the right position where the teeth come together. So if you don't do something to correct that, you're just going to have the same problems in man-made materials that you had in the natural teeth. And a lot of dentists don't know about that.
Yeah,
And
structural
that
support.
yeah, that also goes back to the 1960s, where a very famous dentist wrote a book on the use of these diagnostic appliances in 1964. And he had done 20 years of studies before he wrote the book. And so a lot of this knowledge is not passed on that came from dentistry's roots. You know, I have a lot of full mouth cases of patients that go back to 1950, and all the teeth were handled and the same way, and the cases are followed with for decades, And very often when you correct the problems, that is the end of the periodontal disease and the wear and everything else. And that's the end of the patient's problems. Because if the patient's going to go through all this dentistry, you want to give it its best shot that it's going to work. And if you don't check this out carefully, then they're going to just have the same problems. They're never going to be solved.
Yeah,
And that's a terrible thing.
structure is very important because what affects the jaw and how the jaw comes together, stimulating the muscles, touches upon the vagus nerve, which is in control of the whole digestive system. So your whole system of digesting and getting nutrients from what you eat is affected by how the mouth engineering works, right? Generation of saliva, even.
Yes, and a lot of people have other symptoms. Some people have no symptoms. You could they have no symptoms and they just have abnormal wear or breaking things left and right in their mouth, but they have no other symptoms. Other patients get pain syndromes and headaches and muscle spasm and maybe even neck aches and pain radiating all over the head and neck. That can happen from this. So you have to address those issues
They're
before you
probably
make
seeing a
anything permanent.
chiropractor.
Yes, uh-huh. And there's different causes, and maybe there's more than one cause, and they would need a chiropractor or cervical physical therapy to go along with this.
Yes, because we're one system, aren't we? It's a domino
Yes.
effect, what happens in the jaw, and vice versa. If you have had an injury or something's out of position in the spine, there can be a different kind of transfer, which is manifested in the mouth and the jaw, such as TMJ, for instance.
Yes, and my dad used to give a really good analogy about that. Like, suppose you put a tack in your shoe, and you end up developing a limp to avoid putting pressure on the tack because it's painful. Then, when you go to take the tack away, the limp remains. And the brain and the body have adapted to this. Even though the
Yep.
cause isn't there anymore, the patient still has a limp. And I have seen this happen in the jaws from trauma. And you have to do something about that. In the 1950s, my dad had this patient, and he actually read this article in the uh, Australian Dental Journal about what to do about this. It's really interesting. This patient was closing on the back teeth only, and the whole front was open when the patient brought their jaws together. And when you put the study models together, they went together perfectly. So he read in the Australian Dental Journal in the 1950s when nobody didn't know anything. They took this eraser and they just shaved off a little bit and told the patient to keep trying to bite into the eraser. And little by little, you keep shaving it down until the muscles relaxed and the jaws went back to normal. And he did that, and that's what happened. And that shows, from trauma, the muscle can go into spasm,
It's a
and you
memory.
can get absolutely this happening. So it's very important to really look at things carefully and try to figure out what happened and why it's like that.
Yes.
And the patient was less aware of it than you would think, because somehow the body adapts to
You get
things
used to it.
in ways that are really hard to understand.
Yep. I think a lot of doctors and dentists probably don't appreciate the ongoing effects down, like it's like a chain reaction, isn't it? That's the weak link in the chain, but then it affects the strength of the whole chain.
Oh, absolutely. And the mouth is part of the body, and there's definitely a correlation between the health of the mouth and heart disease and other
Yep.
systemic conditions
Nervous
because
system disorders.
yeah, the mouth is a portal direct from the bacteria in the mouth into the bloodstream.
So
And
close to
that's
the
one of the
brain.
reasons. Yeah. Well, it can go all over the body. Absolutely true. And so the single best thing that you could do is to make sure you have good hygiene, both at home and regularly with your dentist, so that you don't have unhealthy gums which can lead to all kinds of systemic problems.
Yeah. Do you prefer the water flossing techniques or other type of flossing techniques for hygiene? What's your favorite system?
Well, there is no one size fits all. I only care about the results. So if you have somebody, let's say, who has poor manual dexterity, then one of the electric toothbrushes would be better for that person because that will help them greatly. Some people do well just with the manual toothbrush, and if they're getting good results, that's fine. Other people need more than that. Some people need more, such as the water pick or the flosser. So maybe you have to try a few things to see what works best. And so there is no one size fits all. So I don't have any real preference, although I do like the electric toothbrushes better than the manual. And you know, one of the reasons why? It's going to sound silly, but it's the timer. You know, and everyone is the same, including dentists. When you go to brush your teeth, oh, you think you're standing there for a long time brushing your teeth, but it's not. So the timer lasts for 2 minutes, and that can seem like an eternity, but
Yeah.
that's what's needed to brush your teeth properly.
Yep. And also focusing on the gums, isn't it? A lot of gum hygiene therapists say you need to think about brushing and massaging the gums more than the actual enamel of the teeth. That
Yes, you want to keep things clean, exactly, and you want to keep your gums healthy.
and the
If they
blood flow.
bleed when you brush your teeth, that's a sign that something's going on, that you have unhealthy gums. Sometimes systemic conditions cause that. And sometimes you'll see bone loss in a patient that was going along really well. And there's definitely something systemic going on. It's usually either cancer, heart disease, or diabetes, one of those three.
Yeah.
And then I send them to the physician right away. And
And
this usually
also
turns out to be one of
medic
those. But that's
medications can affect how the mouth works, how you digest food. It can dry up your saliva, and if we don't have enough alkaline saliva, we can't protect the teeth well.
Well, that is absolutely true. When I get a new patient, I'm looking at all these medications they're on because I never heard of some of them. They're new medications, and when you look up the side effects, a common side effect of these medications is dry mouth. And patients very often, in order to combat dry mouth, will suck on candies with sugar in it. That can absolutely destroy a mouth. And so it's very, very important to be very aware of that if you have dry mouth. And sometimes I've seen patients, they're on 4 or 5 medications, and all the side effects are dry mouth. And, that could be really devastating. So you got to be extra careful with that.
So just to summarize, the procedure that will more likely preserve the natural teeth via good restorations, via good engineering, bridge work. Can you just summarize that process for people? I'm 67 myself, and there will come a time, I assume, where I'm going to need to be thinking about those things. And you can't live forever, and you can slow aging down, but eventually it will catch up. So what kind of things should a
Well,
dentist consider? And it's really the people, the customers that need to be looking for the dentist that would have this kind of philosophy, that do those kind of procedures rather than, straight away going to implant recommendations.
Well, the first thing is that age by itself has nothing to do with whether or not you lose your teeth or things start to go downhill. It's really more your state of health than aging. You can, if you take care of them properly and God gave you a good setup, you can retain your teeth for a lifetime. That is what we're supposed to have our teeth for a lifetime. Lifetime.
Awesome.
It's not normal to lose your teeth, and that's what Thomas Ford said in the '60s. And that's absolutely the truth when it comes to that. So, uh, and I forgot what I was going to
Yeah,
say.
we need to train all our dentists to go back to the basics of the
Yes,
dental
and yeah, that's
engineering,
exactly what I was going
structural
to say
engineering. Yeah.
when I lost my train of thought. Um, the old timers would be more likely to have better techniques for crown and bridge than the newcomers. And A lot of people are very impressed by technology. And technology is a tool. It's not an end in itself. As dentists, we are responsible for the outcome of treatment, not the means by which we arrived at that outcome. And while there are some good things about digital dentistry, it's not there yet. You can't be a top dentist and only do digital dentistry, except in a field like orthodontics, where you don't have to go under the gum.
Hmm.
That's completely different. But in crown and bridge work, it is not there, no matter what anyone says. And today, the emphasis is on economics and workflow rather than longevity and health. And that bothers me a lot because that's not where I'm coming from.
Yep.
The best feeling in the world for me as a dentist is when I have my patient come in year after year for their hygiene visits, and I get to watch the work that I did last in health
Oh,
year after
wow.
year and
How
year. And
satisfying.
and then you beat disease. That was the end of their periodontal bone loss.
Yep.
So when I
Nice.
set up a mouth for crown and bridge, I get rid of all the disease and I create an ideal architecture. So when I get done, it looks like the crowns are sitting right on the bone in the x-rays. They're not, of course, but it's as close as I can get to the supporting structure as possible. That
We
is the
can,
best
we,
architecture that you could have for health. And
yep.
usually that's the end of the periodontal bone loss. And that's not being taught. You won't see very many dentists who can do that.
Well, we need to change that, don't we?
Well,
Where
I'm
can people go?
trying, but
We, if
it's
they,
like screaming into the wind. I'm trying because I have all
yeah,
the evidence on my side. I have 70
yep.
years of documented evidence where all the teeth were handled well, according to the same basic principles. And I can show x-rays on these patients over decades. No one will listen. That's
I'm
the big
listening.
problem in my field.
I'm sure many people in the audience listening now will be paying attention. Where can they go to find out more?
Well, I have a teaching website. It's www.theonwardprogram.com, ONWARD program, theonwardprogram.com. And you don't have to be a dentist. Anyone can go to that site. And it's all there, all the information. I made like 35 courses for for dentists primarily on this website. And I'm in the process of publishing a textbook that will go along with these courses. And
Fantastic.
I'm able to save a lot of teeth that they're extracting. In fact,
Ah,
I could show miracles that were done that dentistry is capable of that nobody would believe.
that's
And
music
so
to my ears.
yeah, I mean, patients should have choices. I believe
Yep.
that. So doctor means teacher. So when I get a patient, I feel very strongly that I need to take my time and look at everything carefully, and that I need to give the patient all the information, what's good, what's bad, what their choices are, what I think they should do, so that they can make the best decision for themselves. And it's not my place to tell them what to do, but I want to give them all that information so that they can do right by themselves. A lot of times they're not given choices. So
Yep.
I think what patients should understand is if you don't like what somebody told you, if somebody said your teeth can't be saved, maybe another dentist can, and you shouldn't hesitate to get another opinion. That's I think very good
Good
advice
advice.
because
Yep.
what ends up happening, what I see is that people accept that they should get a second opinion for, with the physician because they recognize that, we're not all the same and they may get other answers from other doctors. But they sort of think that dentists do all the same thing and they just do whatever their dentist tells them. And we're actually no different than the physicians. We have
Yep.
good, bad, and everything in between.
Yep. So it's really up to the customer, the client, buyer beware. Check everything out, get second and third opinions. Because once you interfere enough, then there's often no going back. You can't retrieve what was lost.
That's absolutely
So we
true.
have to
And they
be
could be
careful.
very, very sorry.
Yeah.
And they have to really be sure this is something they want to do and know what all the risks are.
It's
And
like
they
getting a
absolutely,
prosthetic.
yeah,
Do you really need to
yes.
lose that much of your limb?
Yeah, well, exactly. Would you let somebody cut your finger off or your arm off? But
Because
they
it's
let their teeth
convenient.
be extracted.
Yeah.
What I see very often is I'll have a patient come in and you could see the teeth that are there are uh, have long roots, a good strong mouth. The roots are curved and they're long, and then you see all these missing teeth, and you wonder, like, how did you lose all these teeth? God gave you a good setup, and I see a lot of that. And the dentists don't know what to do, so they extract the teeth.
Mm. So we're coming to an end. Thank you so much, Dr. Feinberg. I mean, we could talk for a long time. This is such a very interesting topic, and we might do like a sequel down the track if it's okay with you. There
Oh,
there
I'd love
is
to.
a lot to cover, but thank you so much for today. I really appreciate it.
Oh, thank you very much, too. It was a pleasure. I thought you were a terrific host, and it was a pleasure being on your show.
Thank you. Bye bye. I hope you liked this conversation and will share it with others. Let me know what you thought about it in the comments below. If you want to listen to other Body Charge conversations, click like, subscribe, the bell icon, and click all notifications. Subscribe to our newsletter to get updates on blogs, podcasts, videos, and magnesium special offers at electromagnesium.com.au. Relax, recharge, and recover.